Hi, I'm Dr. Zeest Khan, the Long COVID MD. I'm a physician with Long COVID, and I've applied all of my medical expertise to my recovery. Luckily, it's working, and I want to share what I've learned with you. On this podcast, I help you understand your body and understand the healthcare system so you can move your own health forward. We've got a lot to talk about, but remember, nothing I say here replaces personalized medical advice from your healthcare team. Let's get started. Hi, and welcome back to Long COVID MD. Today we're talking about sensory integration and sensory processing disorders after a COVID infection with occupational therapist Amy Mooney. Amy is an occupational therapist based in Illinois who specializes in the treatment of sensory processing disorders in kids and adults. She joined me in a previous episode to talk about the benefit of occupational therapy when you have long COVID. And today we're diving deeper into sensory processing disorders in particular. After I fell ill, I noticed it was really difficult to tolerate light and sound. As I tried to understand these symptoms, I kept thinking, boy, is this how somebody with autism feels? And as I learned more about autism, I realized that I did not suddenly develop autism. But what I do share with many people who have autism or autism spectrum disorders is a disruption to my sensory integration pathways. That is our ability to tolerate external and sometimes internal stimulation. This can be very, very disruptive to our lives, and it certainly has been to me. I asked Amy to share her expertise with us today, and in this conversation, she explains what sensory integration is, what sensory processing disorders are, and how they can present. She also talks about ways to treat and improve these symptoms through occupational therapy and pacing. I'm really pleased that she was able to join us, and I think you're going to learn a lot. This was a field that I did not know very much about before I fell ill, and it has been a key piece of my illness and recovery. So without further ado, here's my conversation with occupational therapist Amy Mooney. Amy Mooney, it's so nice to see you again. Thanks for joining me again at Long COVID MD.
Thank you for having me. I'm glad to be back.
I am looking forward to picking your brain. Can you tell me what a sensory processing disorder is, or what sensory integration is in our bodies?
Sure. Sensory integration is when all of our senses kind of work together. We take in information, we process it, and we have an action or output with the appropriate amount of response. And for people that have sensory deficits or poor integration, it may be a problem with that information coming into the body. So it might be too loud or too smelly or too touchy, too much movement, or it may be not enough. And so they may have difficulty understanding what touch is, so they need lots and lots of touch. They need deep input to be able to integrate that feeling, to know where their body is in space. So input, or it may have difficulty processing what that information means. I can feel that my shoulder is being touched, but I don't know what that means. I don't know if it's my head or my elbow. It's the processing, the understanding of that information. Or it may be output, where you don't know how to respond. Do you grab something but with too much force or not enough force? How do you regulate all of those responses? And so as a therapist, we use strategies or tools in our toolbox to help people understand how their body is being used and interpreted within its own being, and also within the environment, if it's in the classroom or at the home. So we help them integrate, and that might be through more movement, or it may be teaching them strategies that are cognitively overcoming their poor intake or their poor processing skill. So sensory integrative therapy is that treatment for that impairment of poor perception in one's body.
I think about sensory integration as what was my superpower as an anesthesiologist who worked in open heart surgery, who worked in emergency rooms. I was able to hear, look, understand, and plan in a scenario that had a lot of stimuli. And I was able to hold all of those stimuli and process and make a plan and execute actions. And after I got COVID, things changed. It was hard for me to talk to someone when there was a little bit of background noise now. It was hard to follow something visually if I was listening to something at the same time. It is interesting to hear you talk about it come up in children as a characteristic of their neurologic development. What do we know about our neurological system, our psychological system, that makes some people more sensitive to stimuli that most people can tolerate?
That is a fantastic question, because I think most of your life, those skills were working and adapting and constantly changing as you grew and processed and developed from childhood through teenage years and into adulthood. And you were able to refine and define what types of skills you needed for that environment. And so you knew that you could filter out other information that wasn't necessary, and you could focus in your attention for that specific skill that you were your superpower, as you said, because you were able to manage a lot of information. You probably didn't notice background music because it wasn't important to your focus, or lights weren't over bright because you were needing to be able to fine tune your vision for your on task activity. Now, when you have illness, you often, and this can be even just, the flu, you just feel kind of icky, or you have a cold, not long COVID, but just something that's a little bit more taxing on your body. It's harder to use those filters because you have other things going on in your body that are needing attention too. Now, when you have long-term chronic illness, those filters are even more and more strained, and they're pulled away. You don't have the ability to access those resourced energies. It takes a lot of work and focus to be able to not pay attention to tapping of the pen from, your colleague or your kids making noises in the other room. It's hard to be able to filter out those extra stimuli, but it's also understanding that your body has its own proprioceptive and interoceptive type of feedback that it's also asking you to pay attention to. It's proprioception is understanding where your body is in space. So you are just busy trying to keep yourself upright. You are trying to keep your arm elevated so you can reach for something. You're trying to do all of these extra movements that also not only takes sensory input, but it also takes that motor coordination and dexterity that you have to pay attention to, because your body's not giving it back naturally through its mechanical input. So you have to think about it cognitively. And that's extra effort, because that's coming up from a different kind of reservoir of energy that you don't normally use. So that's first point, is your filter system is off. It's unregulated too. You don't have that as a natural resource. And the second is for people that have chronic illness, and especially for, long COVID and myalgic encephalomyelitis, there's neuroinflammation going on. So there's already a lot of neuro hyper responsiveness. And so that aggravated kind of hypersensitivity, the lights seem even brighter and the noises are even more intense. They're painful to have noises and lights and touch. And that's the body's inability to really kind of modulate or regulate that neurological response. And so when people do say, it's painful to have that bright light, it literally is. It's that dysregulation. It's either in an over response or an under response. And it's really it's having a hard time staying in a balanced, stable state.
I did not appreciate all of the activity and effort that was going on in my nervous system to do what I took as very simple tasks. And so as you talk about pain, not only sensitivity, but discomfort and pain to light, sound, it's very familiar to me. And it was very scary when it developed. In addition to people who have chronic illness, where else do we see, or what other diagnoses are associated with sensory integration issues?
Well, autism, the neurodivergency type of spectrum disorders will often say that movement or even, any type of stimulation can be very, very painful. I think in the past we have tried hard, through different therapies to help them integrate those experiences into functionally appropriate behaviors. And in the past, they may not have been appreciated that it really is painful for people to have to go through those experiences. SI, sensory integration, I think is very effective and very, very useful, but I think it needs to be also provided with, teaching people how to come up with cognitive ways to support the level of dysregulation in their body too. Because I think, a lot of times people may say, I'm functioning, I'm working in this office building, but the noises are still really, really, really bright. I work better and I can focus better in a quieter situation. So I think the most common diagnosis for SI would be people with autism or neurodiverse and diverse types of disabilities. It also can be, people that have traumatic brain injuries or concussions. So it's common. I think people somewhat get through their day, but I think by the end of the day, end of the week, their symptoms are definitely worse and they need a lot of rest and time to recover from that experience. But for people that have myalgic encephalomyelitis and long COVID with PEM, that rest does not come very easily. And so those cumulative kind of taxing or exaggerated experiences add to more and more crash-like symptoms, more PEM experiences.
Let's talk a little bit more about medical diagnosis and treatment. As I was researching sensory processing disorders, I found that there is no ICD-10 code or medical code specifically for sensory processing disorder. It falls into a category of psychological, developmental disability or issue. And at the same time, I am finding very clear recommendations to see an occupational therapist because it can be beneficial. Are you noticing that sensory processing disorders are more recognized by primary care physicians, pediatricians, and are you seeing those clinicians refer to occupational therapists like you? Or do you still see a sort of deficiency in understanding and education around sensory processing?
In my world of OT, this is a very common, well-known diagnosis. It often is in combination with other developmental disabilities or delays. It can be also motor planning type of delays. So I think it fits under the umbrella of, especially in child development, it can be part of a more complex type of diagnosis. I guess part of, an adult's diagnosis of long COVID, it wouldn't be a standalone diagnosis, but it would probably just be part of their fatiguing illness, part of their muscle pain, their pain syndrome type of diagnosis that they're seeking care for. So it can be part of many different types of diagnoses, but you're right, it's not a standalone. I think the OT community especially has been fighting for that for a long time, because we do see it as a real treatment path that really does help a lot of individuals receive the appropriate care that they need. And it also offers, especially in the school settings, the interventions that directly affect, how a child receives education services. But turning it to long COVID, it's a specialized type of treatment that I believe that it's not giving constant opportunities for integration, but it's more giving opportunities for that rest. And I see the type of sensory integration that would be most well known in the OT world is also a type of graded therapy. And that type of, let's keep integrating and challenging the body is what a person with long COVID does not necessarily need. Their body might work well when they have all of the rest that they need. But it's that moment when they are fatiguing that they feel the most dysregulated. And so my work with people with long COVID is to take away all of the extra stimuli and really kind of lowering the intensity of the sensory system and giving the sensory system as much of a break as they possibly can so that it's not overstimulated. I often use showering as my basic activity to use as an example. When you think of somebody that's going to want to take a shower, they might have bright lights on or the ceiling fan going, and then they're going to, turn on the water. And so the water is going to be a certain temperature. And all of those type of experiences is already draining for somebody. And, by turning off the lights, turning off the ceiling fan, making the temperature of the water not so intense or hot or cold, but making it kind of that Goldilocks just right temperature. Also changing the intensity of the sprayer from the spout, so it's not shooting really hard water at the person. Maybe even having handheld handle so that they can actually control where the water is going to be spraying. All of those things, in my view, is just kind of like rounding the corners of that work, making it a little less effortful and making the individual get through that particular activity without setting off all of the alarm bells for every sensory system. So when I'm working with my patients, is I'm constantly saying, what are all of the pieces that you know about that is going to be hard for your sensory system? And then let's choose that activity so it's not triggering as many sensory responses. And then how do you rest? So your body just was literally flooded with water. Now, how can you wrap yourself up and keep yourself in a tight cocoon so your body can really deeply rest from that experience? Do you need a heated blanket? Do you need what type of soft material, or do you need a weighted blanket? Because those are sensory systems that you're now trying to calm and reset just from that one experience.
I love this example of the shower. I am not the only one who gets so exhausted from bathing And it's been really puzzling why it is so particularly exhausting to bathe. And what you described makes a lot of sense. I also hear you say that there needs to be a specific approach to sensory integration therapy for people with fatiguing illnesses like long COVID. For many people, sensory integration, if they don't have a fatiguing illness, is one where you build up your skills of being able to tolerate more and more stimulation. And I think what you're talking about is starting from a place, if you have a fatiguing illness, of actually reducing the stimulation and spending time learning how to do that. I find when I'm very tired or I'm overstimulated, if I want to say a sentence that makes sense, I have to close my eyes. And I didn't have to do that before, but it helps me focus. It helps me sort of see the words in my head and the thought, because it's too hard, to walk and chew gum. If an adult has sort of new onset sensory integration difficulty, how should they proceed? What should they request from their primary care doctor? Because a lot of us need referrals. And once referred to an occupational therapist, what should we be looking out for? How should we vet the occupational therapist that might be best for our specific needs?
Okay, can I pop back to the piece where you were just saying that it's easier for you to close your eyes? And
yes.
I think that is a great example of you are filtering by taking away your sensory input coming through your eyes, because you're concentrating on processing information, memory, recall. That alone is kind of, you're spinning wheels in your brain that needs its own focus. And so when you can, especially vision, because it is so easy to scan a room while you're trying to think, that alone drains the energy. So by closing your eyes, visualizing what words you're looking for, even, covering your ears, taking away other opportunities for stimulation to enter your body is a good way to filter when you don't have the filtering skills built in. And it might even be, sitting down so you can do something. Thinking is a hard process. And so changing your position also can be a way to, change what kind of input you're needing. So sitting down, maybe putting your head down, so that you're getting more blood to your brain. Changing those sensory inputs can help you get through that moment at that time. Your second part was, how do you find the help you need? I think I'm biased because I think OTs know this stuff already. They just don't know why they know it. For this particular population, I think finding somebody that is going to be open to helping you better understand your sensory needs is part one, because everybody with this disease, with long COVID and myalgic encephalomyelitis, are differently integrated and differently impaired. And so for some people, they need the vision, and other people, they can't tolerate vision or lights. Even patterns can be very, very stimulating. And so when therapists understand that they can come up with strategies to change their environment. Let's take away the busy curtains in the bedroom, or caregivers that come in with busy shirts that have flowers all over them. That's very, very stimulating for somebody that has to look up at their caregiver and then see this wild patterned shirt. So by OTs being able to understand and kind of go through the assessment to find out what are the triggering pieces for this individual. They can say, auditory or vision or position or all of them. I mean, it may be all of the above. are very, very stimulating for this patient, then they can start coming up with environmental strategies, activity strategies. How do you change where you eat your food when you're too stimulated? Well, let's look at, do you need a weighted blanket? Do you need different types of input for your body so that you can be the best supported so that you can eat a meal? And then even what kind of instrument do you need a spoon that has a little bit more weight so you can have some more coordination and control, or do you need something that's finger food so you just literally take away all of the things that you have to coordinate and just pick up food to get it to your mouth? So an OT is a very good person to get in and analyze all the activity in the environment. Unfortunately, OTs don't necessarily know about long COVID. So it's going to be a learning process to teach them about that particular condition. But I think if as a patient, you can be straightforward and say, when I'm well, I can do it. I don't need to be exercised or given, activities throughout my day just so I can, increase my vision. That's not what I need. I need ways to cut out all of my stimulation so that I can rest and I can do the most important activity I need to do with the least amount of effort possible. And that's the difference between, the traditional SI therapist and the therapist who understands long COVID.
Thank you so much for that advice. To me, I feel two ways about it. It makes me feel like, there are options for me. There are strategies for me to pursue. And at the same time, it sounds like so much work and effort. Like, to think about the spoon that you use, to think about your body position in space when you're trying to do an activity. But I'm going to lean on the positive side and say that it's really great that there are options. I will give the listener my input and my experience with occupational therapists who are not familiar with long COVID, or any therapist who is sort of going at a pace that is a little too much. I started really spacing out the appointments because I see an occupational therapist for my vision. My extraocular muscles are not as coordinated as I think they used to. So visual input is even harder now than it was. And she, like you were saying, approached this as graded. Like, okay, now we're going to increase this and we're going to increase this. And next week, we're going to do the next step. I was like, I need 3 days to recover from this appointment. I'm not going to do these exercises for a while. So one way I've gotten around it, I work with excellent practitioners, but I need to do it at my own pace. If they're going too fast for me, I just slow it down. Amy, what else do you want the listener to know about sensory integration and changes in the sensory integration process that we haven't covered yet?
I think letting your listeners know that their body is giving them information, and listen to your body, because your body knows. And it's just a matter of kind of paying attention to what is it that's making this activity hard? What are you struggling with? Is it that, being in this particular room is just too noisy and too loud? Or is it the lights that are so bright? Is it internal vibrations that are setting your body off? Kind of go through a checklist with your body to find out what it is telling you, because some things you can change. Some things, if you have to wear headphones for a certain amount of time during your day, or if you have internal vibrations, sometimes your body is is calling out for some movement, but you're so fatigued that you really, really can't do it yourself. So my advice for many of my patients is have your caregiver give you that input while you lay passively receiving that input, because the nervous system wants to move. It organizes itself as through movement. And if you cannot do that, sometimes like rolling the hips and just have your, laying on your bed and having your caregiver just give your hips back and forth motion, very deep pressure, like input to the hips and then rolling them side to side. Or, sometimes somebody's looking for just gentle body shakes. And other people are saying absolutely not. That will totally put me over the top. So I need deep, deep pressure. I need a weighted blanket. I need a cocoon-like every joint hugging myself input. That may change. Like for 10 minutes, they may need it. And then they say, absolutely, I'm done with this. I need to be opened up and let loose. So I think just paying attention that your body is wanting things and it's constantly changing, and just kind of being fluid with that type of input, because it's trying to self-regulate. It's just super confused. But some of those type of movements might give you brief episodes of rest. And I want people to find their kind of toolkits or their support kits of what items bring them rest. Is it an eye mask? Is it ice packs at the back of their neck, kind of calming their nervous system? Is it, like I said, weighted blanket, or is it even vibration? Some people like to have like a Sensate or a vibrator on their chest, because that gives them the external movement that their internal body is kind of trying to fake. So looking through all of the types of sensory systems in a kind of a checklist and seeing what their body would feel comfortable with is how I try to help my patients kind of start their rest and know that it, like I said before, it's going to change, and don't feel stuck like I have to do this because this is what gave me a little bit of rest before, because it's a different moment and your body is going to be changing. So I guess just keep giving yourself some grace and some peace, and just see what could possibly be options for future you and current you.
Amy, thank you so much for joining me today. I love picking your brain about how to understand our bodies when they are confusing us. That's really, really empowering. Thank you so much for your time, and thank you for your work.
You're welcome. It's so good to talk to you. Thank you for letting me be here.
Thank you again to Amy Mooney for joining us and sharing her expertise. I have been a physician for a long time, and I am ashamed to say that I am only now recognizing the depth of expertise that occupational therapists really bring to the medical field. It is a resource that is available to many of us, and I encourage you to take advantage of it. I'm leaving links to Amy's website in the show notes so you can get to know her better and reach out to her if you want to collaborate. I'm also going to leave links to our previous episode with Amy, where we talk about occupational therapy as a treatment for long COVID in general. So let's talk about some takeaways from our conversation today. The first for me is that sensory integration requires energy, and that means it can lead to some fatigue. This is true if it was a background process that you didn't even realize was happening, which was the case for me before I fell ill, or if it is front of mind and disrupted, as is the case for me now after my COVID infection. So recognize that your body is doing work and accommodate for that by giving yourself enough time to recover from activities. Next, I want to clarify a couple of terms that Amy used in our conversation: proprioception and interoception. As Amy described, proprioception is our body's ability to know where it is in space. It's the reason that you know your hand is in front of your face, even if your eyes are closed. It's the reason you know what direction you're going to be facing, even before you turn. Interoception is our body's ability to recognize cues and signals from our internal organs. So it's the reason I know I'm hungry. It's the reason I know I need to use the bathroom. Both of these pathways are a type of sensory integration and can be disrupted after an infection. The next thing on my mind is that sensory processing disorders reflect a blind spot in our medical field. It's categorized under the umbrella of psychological developmental disorders, yet it has clear biologic underpinnings. We know that from seeing new onset sensory integration issues after illness, after stroke, after traumatic brain injury. At the same time, even though sensory processing disorder is not a standalone diagnosis, it's pretty clear that particular treatments help, and those lean heavily in occupational therapy. So that, to me, reflects some cognitive dissonance in our medical field. I'm going to keep an eye out in the coming years to see how this might change as we get more awareness about sensory processing and about autism spectrum disorders as well. So let's talk about how to find help if you're struggling with some of the symptoms that we discussed in our episode today. If you are struggling with some of these, you might benefit from working with an occupational therapist for sensory integration therapy. If you need a referral from your primary care doctor, talk about your symptoms. Tell them that you're having trouble tolerating light and sound, having difficulty retaining focus in a way that's interrupting your ability to work. It might be interrupting your ability to maintain your activities of daily living. It might be so disruptive that it interferes with your ability to shower or take care of yourself. Ask to see an occupational therapist to get evaluated for a sensory processing disorder and potentially try sensory integration therapy. As Amy mentioned, most occupational therapists are trained to help people with sensory processing disorders, but not everybody is going to understand long COVID and your specific needs. So talk very openly about your expectations, your capabilities, and the pace that you want to go. If your therapist is still moving at a pace that's too fast for you, one way to rein them in is by spacing out your visits so you have enough time to safely implement some of the exercises that are going to be prescribed to you. I also want to remind you that sensory integration relies on our senses, so it's a good opportunity to get your vision and your hearing checked. And lastly, speech therapy can be complementary to sensory integration therapy through occupational health. So consider cognitive rehab through speech therapy, and you can learn more about that from a previous episode that I've done here on the podcast. I'll link to that episode in the show notes as well. Let me know what you think. You can reach out to me at longcovidmd@gmail.com. You can also sign up for my free newsletter at longcovidmd.substack.com. I send out a newsletter that summarizes every podcast episode, so you have something that's easy to read and refer to, and something that's easy to share. So that's it. I hope you're feeling well. Let me know what you think. Take good care, and bye for now.